Hey everybody, Dennis with Respiratory Sensei here. We're on Egan Chapter 8. But I have to take just a moment and stop right now because you may be wondering, we've gone through 7 chapters already, and in most of the chapters when I talk about them, I say, well, you don't really need to know much about this chapter. What I'm talking about is that you don't need to know much for taking care of patients in real life. It's just not practical information, or you don't need to know it for the NBRC exam. So the best question that you may be asking now is, well, when does the Egan get interesting? And the answer to that is Chapter 11. So Egan, just like many textbooks, has the frailty, the problem of starting off with the very boring, probably non-needed stuff. It's like opening a book for microbiology and think you're going to be studying cells and pathogens, and the first thing they talk about is, well, the history of the microscope and who's the father of these lenses that they've created. And so fairly boring stuff. Well, Egan's not exempt from that. So today, for instance, we're literally talking about research. And research is not something that you're going to do a lot as a respiratory therapist in your everyday life, and it's also not on the exam that much. I say that, but we will talk about one thing on the exam. But when we fast forward to like chapter 11, that's about ventilation, and that's when it starts getting interesting. So just hang in there with me, and I'll just tell you what's on the exam, but I may be saying a lot of times there's not much. Okay, so what is in chapter 8 that we need to know about? It's called evidence-based medicine. And you don't need to know a lot about this for the purpose of the exam, except that you're already using evidence-based medicine principles that can be found commonly in the ARDS-NET protocol, which you do have to know a little bit for the exam. Here's what you just need to know about evidence-based medicine. You have to know a few of the evidence-based principles like the ARDS-NET protocol, the National Asthma and Education Prevention Program, and the gold standard for the treatment of COPD. And here's the final thing I'll just tell you about it, and that is that they can change their standards very, very quickly. It's not uncommon for some of these organizations to change every year. And so when you think about using evidence-based medicine to know what to do, then you probably need to look at the current year's edition and see if that's still the protocol. Because just because you know what it was 3 years ago doesn't mean you know what it is today, and that's the essence of evidence-based medicine.